So hello guys and welcome back to the channel Guide to Glory. So in this video, I am going to tell you that what you need to do in second year MBBS or how you need to prepare it. But also I will tell you the DBMCI approach because ultimately I had taken DBMCI for studying second year MBBS and as a PG coaching institute. So my approach to second year would naturally be connected to DBMCI. So the video is naturally connected in itself. So I'm to tell you also about DBMCI and also simultaneously how to prepare second year MBBS. So let's start. So coming to first point, that why I had chose DBMCI. So DBMCI is a very good platform. In it, all the teachers teaching is very good. And what I personally felt was that it gives a natural connect to you, and the teachers and all the faculties are there to listen to you. They are always ready to change the schedule as much as it is possible and as much as it is in their hands. So they are also ready to change the topics if our exams are coming nearby, so that some things can be altered, and so it gives a better student to teacher connect. And one more reason was that in first year I had taken a kind of crash course of first year in DBMCI for the last 3-4 months in when I was preparing first year MBBS during lockdown. So it gave me an experience of how DBMCI is. So I was able to connect to it better. And I thought that instead of again reconnecting with some other institute, I should join such institute which I already connected to, and which I feel more of a which has more of a personal touch to it. And also along with it, it has regular tests. They have proper planning of an entire year, although it keeps on changing, or it might be changing according to the teachers availability or maybe students concern or their schedule according to the college tests. But in general they have a plan, and they have planned for 3 years. That's what I feel. So I am personally not that kind of a person who is more of a self-disciplined or is able to make a very good accurate timetable, to be honest. So I prefer more of something which is already told to me that I have to do this topics in this much duration. And with the weekly test coming up, we have to naturally prepare for it to give a good test. So in that way, the subjects also get prepared, and we also are able to finish understanding and seeing videos and learning the concepts of it. And topic by topic, our subject gets prepared. So these were the reasons for me taking DBMCI. And as far as managing college classes is concerned, that then I have already told you that they are ready to be flexible regarding the schedule, regarding the timings, but still the classes has to be there, and they are of 4 hours, probably uh, 2 to 3 days a week, and maybe even on weekends, which might get changed. So the natural question comes that 9 to 5 might be called, and then if there is 5 to 9 class, then how to manage studies? So what I used to do was I used to decrease going to college classes to naturally get some more time for self-study, because I am more of a self-study kind of person. I'm not that kind of person who learns from listening to lectures or seeing videos again and again and learning from them. I am that kind of person who just understands a concept once and then tries more to revise it or more to recall it, rather than understanding it in different ways by different teachers or different videos or something like that. So I used to do that, although that's not the ideal way, to be honest. And you also know that there is some issue of attendance, so I shouldn't say it, but you all know that proxies are common in college. So I also used to do some proxies by my friends. So that was the thing. I never used missed words per se, because it gave me practical knowledge regarding it. And all in all, they also provide you the recorded videos of the live class which has go on. So if I have to miss some class by chance, then I can watch the recorded part. Or if something is that if I have watched the or attended the class for 3 years and maybe due to any reason I'm not able to attend the last 1 hour of the class, then I used to watch it again in the recorded format. So that's how I used to manage DBMCI along with the college classes. And as far as exams are concerned, then I used to read mainly from the notes given by DBMCI. So if a topic was completed in DBMCI, then I used to do that only. And if a topic was not covered and still was used to come in exams, particularly during internal exams, then what I used to do is I used to watch those subjects from e-Gurukul videos, make notes, and try to leave a lot of space in the notebook so that when I attend live classes, I can make different changes. I can write that this is not important and not taught in live class, or maybe this is important which was not there in the recorded part. So it may be something new, something latest, or maybe something which is more important now which was not previously, so it was not in the recorded part. So I used to write those things. Now coming to the individual subjects, like how to prepare them. So first of all, coming to pathology, that how to study pathology. So in pathology, as I already told, I used to watch classes. So what you can do is you can attend the classes, you can watch videos, make notes, and then revise those notes to build a foundation and to understand the subject. And during the time of exams, you need to stick to IMPs, because especially in our colleges, I don't know about other colleges, but I think it would be same throughout India, because generally the patterns are almost same in almost all the colleges of India, and I don't think any major changes in that. So what you can do is during exams you can stick to simply IMPs, because they ask only IMP questions, or rather I should say most IMP questions only they ask. And the paper pattern is also such that you can modify your study according to the paper pattern and get very good marks. Because in our time, uh, if I tell you, then at the time of university exams, there used to be 40 marks of 2 markers. There used to be 20 questions of 2 markers. So if you just do 2 markers question, which you might get from your seniors or from anywhere or maybe some book, then probably you would be very much relieved about those 40 marks already. And then from those 60 marks, few questions would be of 10 markers. So you know that the most and most IMP questions only would be asked. So you kind of get relieved from that, and you are able to plan in a proper way, and you can give very good exams. Because the thing is that you don't need to read everything, and it's practically not possible to read everything at the time of exams. So at the time of exam, you need to read only the most and the most IMP questions, which are regularly asked in the previous exams. And otherwise, you can watch class videos, revise notes, read textbooks, and do as much as you can to increase your knowledge. Now coming to the pathology practical part. So first of all, I am going to tell you what is there in the practicals part. So first of all, there is something called as spotting, in which I am telling about my exam, that how it went. So there are 10 spots, and all those 10 spots are generally based on mainly of tray. There is a tray, and in which there are different instruments like vacuities and Westergren, pipettes, etc. There is a picture of the spot, and we have to identify it and write its use. There is something like that kind of stuff. Apart from it, there is one question of a different type of RBC, like macrocyte or maybe teardrop RBC or pencil cell RBC or something like that. So you have to write about it and write the condition in which it is seen. Then there is one or two questions of gross specimen. They tell you to identify the specimen and tell the disease. And one or two questions are from histopathology, like they give you picture of some slide and tell you to identify what it is and in what condition it is seen, something like that. Coming to the next part, there is something called a tray viva. So as I mentioned you about the tray, there are a lot of things in the tray which you can see in your college, and they ask you viva regarding it, that what it is, what its use, etc, etc. Then there is something called as theory viva, which is obviously common in all the subjects. So they ask you general questions, simple basic questions from the theory, and you need to answer them. Then coming to gross specimens, there are a few specific specimens which they ask, which they keep during the exam time. So at the course of a year, what you can do, you can learn the gross specimens as a part of increasing your knowledge and to understand the conditions and to understand the subjects better. But at the time of exams, they conduct a revision session in which they keep the gross specimens only which are important. So you can click photos of that, or and then at the time of exams you can only revise those specimens, because those 10-15 specimens only they keep during the exams. So you need to just prepare those most IMP gross specimens. And the same is the case for histopathology, because at the time of whole the year they will show you a lot of slides, but they don't keep all the slides or at the time of exams. They only keep particular kind of slides in the exams which they give you at the time of revision. Those 15-20 slides you can prepare and you can give the exam. Coming to hematology, so in hematology there are three parts. So one is DLC, that is differential leukocyte count. Basically it is peripheral smear examination, and all the students need to do differential count and write in the book, and uh, teacher will ask viva regarding that. Goes same for all. Maybe if it's urine examination or histopathology or gross specimen, it's a natural thing that teachers will ask you viva once you identify the things. Then there is another part called as total leukocyte count, in which you have to count the leukocytes in Neubauer's chambers, which you used to do in your first year. And also there is hemoglobin estimation by Sally's method, which also you have done in your first year. So TLC and hemoglobin estimation would be an option. That is, half the students will get TLC and half will get hemoglobin estimation. Now coming to urine examination. So you have to do physical and chemical examination of urine, particularly mainly chemical examination, because in physical examination there is something like color, odor, and appearance, which is important but not that much important. The main thing is chemical examination. So you have to do 5 tests regarding that, and write its observation, its inference, and as I said earlier, the teacher will ask you questions regarding it. So that is about pathology practical. Now coming to the next subject, how to study pharmacology. So in pharmacology, the basic concepts remain same about preparing, that you need to attend classes, then make notes and read from it. Now, there is one different point which you need to remember, that pharmacology is a vast subject, or I should say, they ask in such a way that it becomes vast. They ask a lot of questions, made with 3 markers, 2 markers, 6 markers, 4 markers, 5 markers, 10 markers. So the paper is very long, I should say. So they cover a lot of things. So that's why you need to study more from textbooks, and only class notes will not do. You can read class notes and lectures for as a part of increasing your understanding, but at the time of exams you need to see previous year's papers and you need to see IMPs, that what they ask, and you need to read those things from textbook, because it's not they just need answers, they also need why of the answers. To give you an example, if they have asked you the ADRs of certain drug, then they don't just expect you to write those ADRs, but they also expect you to write why those ADRs are caused if it is given there in the textbook. And same goes with the uses as well. So if there is a certain drug and it is asked that mention its uses, that in what in which conditions it is used, then you don't just need to write in that in this conditions it is used, but you also need to write that why it is used in those conditions. That's why it becomes important to read IMPs and previous year's papers to write the answer in a proper way to get good marks. Now coming to the practical part. So in practical of pharmacology, one thing is common of all practical that we all know, that is theory viva, which we all know. So that's nothing to be repeated, but I still need to. So then there is formulation viva. So there would be a tray in which different formulations would be there, like oral and topical, parenteral, etc. Like there are certain syrups and certain tablets, etc. So certain drops, eye drops, ear drops, etc. So they will ask you to identify different formulations and tell about so one or two sentences or to differentiate different formulations, like differentiating a syrup from an elixir, etc. So and also in that they will ask you about your, and they will try to know your skills. So they will ask you that how to insert eye drops or how to insert ear drops. So tell me. So we need to tell the steps. And in combinedly theory or formulation or somewhere, they will also take a communication viva in which you need to tell about that communication, tell your communication skills, in which they will act as a patient and they will ask you some question and you need to answer them and you need to counsel them as a as if they are your patient and you are their doctor. So that will check your communication skills as well. Coming to the next part, there is there is ADR and PDL. So half students gets ADR and half students gets PDL. So in ADR, you have to fill the ADR reporting form, and teacher will ask you viva for that. Now I think I need to stop repeating that you will ask about viva because it's always asked. So I should stop it, I think. So coming to the next thing, that in PDL, so in PDL, you have to, what you need to do is you need to write about the which are the plus points and which are the minus points of those promotional drug literature given to you. Which are the good points in it and which points are missing. And again, now I'm not going to say that. Now, next comes SDI, FDC, and pre-drug. So you might get any one of three. So in SDI, it is basically sources of drug information. So you would be given a certain questions and you need to find those answers from textbook. Yes, you heard me right. You can use textbook in exam. This is the only part of any exam which I can say, may it be theory, practical, and even practical of pharmacology. This is the only segment part where you can use textbook to give answers. So in that you can write up because they ask you generally the cost of different drugs and maybe for dosage, which or maybe brand name, which we generally don't know. So that is comes in SDA. Then in FDC, they will, that is fix those combination. They will give you combination of 2 or 3 drugs or maybe even more, and they will tell you that you need to write, is this combination rational or irrational, and we need to justify that why it is rational or why it is irrational. Then comes P drug. So you would be given a case in which there would be a condition and you need to write about P drug, your P drug from it, and follow the format which is there, which you would be taught. So I don't think I need to go into details of that. Coming to prescription. Now there are two parts in prescription. There is one is prescription writing and one is prescription criticism. In prescription writing, you will be given a case for which you need to write the prescription. And for prescription criticism, there would already be given a prescription for a condition and you need to criticize it. You need to write that what points are missing in the prescription and what are the points which need to be included, and if a wrong drug is given or if many drugs are given which are not necessary, then you need to write everything about it. And also one point I would like to mention about prescription writing is that don't try to mug up the doses of it. Certain doses of certain important drugs that you will naturally learn or you need to learn or you should learn for your theory exams as well, because doses of such drugs are important, such as drugs for malaria or maybe drugs for TB, or I should say rather the regimens which are there, the dosage of those regimens are important, and we need to remember that. And certain doses of certain drugs you will remember naturally only. For example, we all know that paracetamol is given in 500 mg and 650 mg, or 3 times a day in general, or maybe to any whenever we have fever or something like that. So we know certain doses of certain drugs naturally. So otherwise that, you don't need to waste your time or bang your head learning different dosages, because they don't cut that much marks for dosage per se, and they mainly see your format and mainly see that if you have written the correct drug or not. That's the main thing. Now coming to the experimental part. So there is a section called as experimental pharmacology, in which different experiments which used to be performed on frogs or different animals. Yeah, I know it's outdated, but we need to learn that. So they will ask certain questions about it and we need to answer them. I don't understand it, why they ask that what experiment can be done on rats and rabbits, which is very much restricted nowadays. I won't say that it is stopped, because today itself experiments are done on those animals itself, but it is very much restricted and they need to go through a lot of steps. Not going into details of it. I practically personally find it not relevant, but I am not the education commission. So leaving that and coming back to the video. So coming to the next subject, that's how to study microbiology. In that also basic is same, that you need to watch videos, attend classes, then make notes. And in that also you need to, as I said in pharmacology, thus to some extent it holds true in microbiology as well, because in microbiology they ask something which you don't expect in microbiology. For example, they ask you a lot about pathogenesis, which is actually a subject pathology. So pathogenesis should be asked in pathology, but they still ask here. They ask about, they might ask about treatment, although it's rare to ask treatment in microbiology. Microbiology is mainly concerned about the laboratory diagnosis of different or microorganisms, but still they ask a lot of questions which you or we might not feel that these are questions of microbiology, but still they ask it. That maybe to write clinical features of it, or maybe steps to prevent certain diseases, which is actually kind of a topic of preventive and social medicine, PSM. We need to learn that in there as well, like vaccines and all. But still they ask it, so we need to prepare it and we need to write it. So it's very important to read previous year's papers, rather I would say, rather than IMPs. It's even more important to see previous year's papers, so that you get to know what kind of questions they ask and kind of get a groove in it. It's more of previous years and less of IMPs, because IMPs will just tell you topics, and topics more or less you will be able to prepare mostly all the topics by the end of the year, because it is a very small subject according to me. But you might get shocked by seeing certain questions, because they might not be the expected questions. Like they might even ask about something from annexure part, like bioterrorism, although it's an important topic, but it's not given in the textbook per se, because it is given the end of the textbook in annexures. So they might ask you from the annexures as well, and they can ask you from anywhere, and like even some acronyms, and they might tell you to write the full form of it, the acronym which you might have seen for the first time in your life. Yes, it happens. That's why it's better to prepare and read previous years and then give the exam. Coming to the practicals part, again, it holds true that in practicals there is not much which you can prepare from it, because more or less the things remain same for theory only. There are certain few things which are different. Is there is uh, at one point they will show you all the different things which comes in practicals part. So they will show you different culture media, so you need to know them. Yes. One more point I would like to tell you, that you need to remember the composition of different culture medias and different tests, like what components are there, or maybe what principle is there of different biochemical tests also, because they ask you that they ask you which is not covered in theory part, or you might not even find it in theory part, but they ask you different composition of different culture media, or they might tell you that what is the principle of this test, maybe indole test, citrus test, what are its constituents, etc. So you need to prepare that. Apart from it, in it there is one called a specimen collection and transport and prevention of disease, kind of what I should say, infection control. These two are parts which are there in practical part, which is not given so well in theory part, or either I should say in Apurva Shastri, or maybe we don't read it. But at the time of college classes, the practical classes, they teach you well about it. So you need to attend the practical classes really well. Try to make notes of those practical classes and then read from it. Apart from it, there is textbook there for uh, uh, referring, but still it's better to make notes while attending practical classes so that you can read them during your practical exam. And then there is something called a stool examination, for which you need to identify the stool uh, of different eggs. And then again, I think you got it. Yeah, Viva. Then again, there are two things which you need to perform. That is, one is gram staining and another is ZN staining. You both need to perform, which you would get it by practicing, and it's not that difficult. Again, Viva. Yes, there is Viva. There is always Viva. It is practical exams are more concerned regarding Vivas only. I would say that even if you perform badly in any of the practical exams, not just microbiology, they won't cut you that much marks unless and until you have given Vivas very good. So your theory base should be really well. And theory base of practicals, I should say, because practical questions are really different from theory questions, in particular in microbiology case. So that's why that's the case. Now, I hope you haven't got bored till now, because this is turning out to be a long session, much more than what I had expected. But still, so coming to wards, that there is also one that read a question that what to do in wards, because I personally used to feel that whenever I used to enter some new ward, of a few days, so 2 3 days, I just used to get to understand what you need to do here, that why are we here, because certain words are like that we don't even understand why we are there. So what to do in words? So I'm particularly talking about second year, that not to worry much about the words, because generally the teachers itself are very much lenient, and they are also just trying to uh, introduce you to different final year subjects and different ward postings. So they are also not that much strict, and they also want to sensitize you to the different subjects. So try to attend those wards, attend the lectures which are taken during the wards, try to make notes from it, and try to revise it that only during ward endings which comes, and not to take very much tension about ward ending exams, because there is a very small exam conducted at the end of any wards, which may be of 15-20 marks. In certain major subjects like surgery or medicine, it might be a bigger exam. For that you need to prepare well, and otherwise it's not that much of headache, or kind of you need to take tension about something. So it's okay, you can just go there. If you're attending wards, try to understand how they treat different patients, how they communicate with them, how they manage them, how they understand that what is the disease according to the history. Try to take histories, try to learn how to take history, how to do different examinations as far as it is your concerned, and as much as they allow you, or as much as which is important to you. Otherwise you don't need to take that much pressure of words per se. And for books of words, I have already told you in my previous videos regarding which books to study in second year MBBS. So you can get it from that video. So that's it from today, guys. It's a kind of a very long video, but maybe important enough as well. So uh, see you guys in the next video, and different other approaches will come in upcoming videos. I will invite different my friends to and shoot videos with them regarding different approaches. Like if you're taken dams, what how to read, if you're taken marrow, how to read, something like that. If you haven't taken anything, then also how to prepare for second year MBBS. So not to worry about that. I would be uploading it in the upcoming videos. That's it from today, guys. This is me, Yash Gandhi, signing off.